Good morning, everyone. Welcome to Vitalist Health Foundation. My name is Melanie Mitros. I'm the Director of Strategic Community Partnerships here at Vitalist. I am the one who's behind the scenes with all of our grant making, assisting with helping you get to the point of submitting your grant, and then assisting the reviewers throughout the review process, and being your main point of communication related to the grants. The other person in the room that's very important for you to know who they are is Jennifer Elmore, just back here behind us. Jen is our office administrator. She is the ringleader to the circus that occurs here in our office. I will absolutely say that. If you have any questions related to the online grants platform, submitting your LOI, technical questions, those kinds of things, Jen can be a resource as well as myself. We do have both of our contact information listed on the last slide, as well as all of our contact information is listed online. So, but it is probably easiest, Jen, would it be easiest for you two to send an email, or are you easier by phone?
I'm available whenever.
Wherever, however. So Jen's pretty easy. I am by far easier to get a hold of by email, just because I'm usually in and out of meetings. I'm going to stand up so I'm a little closer to the mic. The folks online are saying I'm a little quiet today, which is unusual for me. Right? Oh well, sometimes we have days like that, right? All right. So you know who we are now. I've already kind of skipped over the introductions. If you are already working with another staff member here at Vitalist, please continue to work with them. Don't feel like you have to come to me on anything related to the grants, but do know that I am your grants resource, particularly when we get down to the nuts and bolts of the logistics. I'm the one you want to reach out to with this. So a little bit about Vitalist. Our vision and mission are pretty self-explanatory, that all individuals and communities in Arizona are healthy and resilient. Our mission is to connect, support, and inform efforts to improve the health of individuals and communities in Arizona. I don't know if you've ever been on our website, but on the home page, you'll notice these two don't match what's right there in bright orange yellow letters. What you see on that home page is like our slogan. Everybody needs a good slogan, like just do it or whatever it might be. So that slogan is improving well-being in Arizona by addressing root causes and broader issues that affect health. That's really getting down to the nuts and bolts of how we want to do our work. A little bit more about Vitalist. We serve as a convener, a framer, a catalyst of key health initiatives. Anybody remember when we were Statements Health Initiatives? Kind of nice to say we're Vitalist Health Foundation and what we do, not who we're not. But I think it's important to recognize the history of what brought us here. Back in 1995, St. Luke's Health System was sold from a nonprofit status to a for-profit status. That sale, the proceeds had to then be reinvested back into the community, which formed us as a conversion foundation. So yes, we are a trust fund baby organization. That's the best way to describe it, is we have a trust fund. The great part is we get to do wonderful things with that trust fund. So over the 22-year history, our trust fund has grown from about $76 million to 122, maybe 123, depending on how good the market is. And we've been able to invest approximately $105 million back into the community. So it's just kind of helpful for folks to see and hear a little bit about who we are and kind of where we came from. Our overarching goals have not really changed a whole lot over the last 10 years. You might have heard them previously called priorities or priority areas. We have shifted that conversation to goals and really trying to be focused on these 5 overarching goals. The 5th one is new. It's newer, probably 6-7 months since we've established that 5th goal of increasing civic participation for inclusive decision-making to advance health equity. If we are going to be honest with ourselves and recognize that to change policies, change practices, we need the community that's being impacted by those policies and practice to be participating in decision-making. And that's often a pretty big stretch that's necessary through civic engagement, civic participation, technical assistance, a lot of different pieces that are included with that. So I just want to make sure that that's there and that you know a little bit about that 5th goal. All right, moving on to setting the stage for the innovation grants. We truly believe that the backbone of innovation is collaboration. To find innovative solutions, we need to bring people and ideas together, often in unexpected ways. What would it look like if each individual organization set aside their individual agenda and worked towards a common goal? A common set of results that we want to make a difference on. That's what we're looking for in these innovation grants. Graphics should look quite familiar if you've been on the website or if you have a handout in front of you. This is the innovation grant cycle. It's kind of the community innovation cycle that we're looking at. If you've ever heard of Plan, Do, Study, Act, or PDSA cycles, this might look kind of familiar. You identify an opportunity to transform. You create collective understanding around the issue. Sometimes those go back and forth several times. You start to generate ideas. What could we do differently? How could we do this where we can make a different impact? And then you start to test those solutions. Often you test those solutions and have to go back to the beginning or go back to step 2 or 3 or whatever that might be. But it's acknowledging that this is a process. It's not a linear line. We're not going to get from A to B. It's going to be A to Z to D to F, whatever that might look like. But what we're looking for in the innovation grants is that sweet spot of being ready to test one of those solutions. That innovation is a breakthrough in addressing a community issue that is more effective, equitable, and sustainable than existing approaches. Not some bright, shiny new technology, not innovation in that sense, but doing things differently to improve the health of our communities. The other piece I think that's really helpful for folks to be able to put into context around the innovation grants, when you have a financial portfolio, so like your personal financial portfolio, your work financial portfolio, you want about 90% thinking like a banker. Strong, steady, slow returns. So it's pretty predictable. You know you're going to get returns, they may not be huge. That other 10%, think about it like your venture capitalist fund. It's your go big or go home fund. That's what our innovation grants are for us. So if we look at our entire budget, we have a $5 million budget. Our innovation grants are $500,000. So it's about 10% of our entire budget. That's our go big or go home fund. We are looking for those innovative ideas that can push the envelope, pull a lever a little harder than we would have expected. Sometimes they don't work. We acknowledge that. We know that that's a possibility, but we know that if we try and we succeed, we're going to have even a better impact on health outcomes. Qualifications must be, the applicant organization must be an Arizona-based nonprofit serving Arizonans. The entire project must be focused on serving Arizonans. If you are working with a fiscal sponsor, a recognized fiscal sponsor, perfectly fine. We have no problem working with fiscal sponsors. Only one letter of intent per organization. We do acknowledge that we have several very good universities and local health departments and state health departments that are huge. And by asking them to only submit one, that would be really difficult. So what we allow with universities and really large institutions is to submit one per department. I will say, please be very thoughtful if you're working with one of those large institutions on sending a whole bunch in does not mean that one will get picked. Be strategic and really thoughtful about the 1 or 2 or however many that get submitted. These innovation grants require partnerships. If this is a single organization submitting this LOI, it will get pulled even before the reviewers lay their eyeballs on it. I'm just going to be really honest. We cannot do this type of innovation and systems change work not being collaborative. We have to work across groups. It cannot be a continuation of an existing program. So if you have a wonderful program that's providing services, thank you. It's not a fit for this grant program. I just want to be honest. We are looking for innovative projects that have a defined start and an end. But we also recognize at that end point, you may have a new policy that needs implementing. That may require money. That's fine. But acknowledge that this is a start and stop project. And if you are a current innovation grant awardee, congratulations. Please do not apply again this cycle. Wait until that grant is closed out. You may be working with us on other grant streams. You may be a medical assistance grant, you may be a programmatic grant, you may have a contract for technical assistance. Those are fine. That's not the same line as the innovation grants. Those are completely fine to still apply. All right, this is your overview of the different items that we're going to walk through this morning. I will tell you right now that all of the listed items and questions on these different slides are the scoring criteria that the reviewers are using. We have taken a step further in transparency this year that you will see what the reviewers are also using to guide their review. We feel like that's the best way to be able to set you up for success, so you know what we're really looking for. You know the questions we're looking for. And again, don't panic that you need to write all of this down. You will have the full slide deck by close of business tomorrow. Maybe I'll get to it this afternoon, and you'll all get an email notifying you once it's loaded. All right, community innovation. So some of the key characteristics we're looking for is, again, that meaningful engagement of key stakeholders. Who are the partners? Have you identified those partners? Have you identified your adversary stakeholders? Have you started to figure out a strategy of how to work with them as well as your champion stakeholders? Is there a willing sharing of ownership and decision making? Sometimes that's one of the harder ones to shift over into with a collaboration. Creatively using existing community resources and assets, and collectively practicing testing and implementing solutions. Again, that's that plan, do, study, act cycle, knowing that this is not going to be a linear path. You may hit a roadblock, you may need to go back to step 0, you may go back to step 3, whatever that process might be for you. Okay, number 2, systems change. By definition, a systems change is one that is fully sustainable and not connected to grant funds or external expectations, but rather an organizational or cross-system priority to new policies, culture, communication, or practices. That's what we mean when we say a systems change through policy or practice. If you are successful, that new policy or practice exists at the end of this grant. You may have additional funding that's necessary to implement, to go through the rulemaking process, to work with staff on training them in the new practice. Those things very well may exist. We acknowledge that. That may require additional grant funding. It may require reimbursement mechanisms, whatever that might be. But for the frame of this grant, we're looking for that policy or practice change. And policy or practice change can occur at any level. If you're going for national, awesome. You may be crazy, but if you succeed, you will get a bear hug from me. There will not be handshaking, there will not be high fives, it will be a bear hug. Just know that that's coming. It can be state policy, it could be working with the legislature on a new law. It could be local policy, it could be working with your city government. It could be even further down than that. It could be at a neighborhood level. So it doesn't matter where that is, as long as there's a clear definition around your policy or practice change that you're proposing. A few more reflective questions to think through as you're looking at your systems change. These again are some of those questions that are guiding the reviewers through the systems change section. All right, and then the next fun part, equity. This is our work. It's not something different. It's not a separate section. It's not, something that sits over here on the shelf that we, do later. Equity is the work. It's the way you do the work from here going forward. It is who you're engaging today to come up with the idea to put in the letter of intent. It's not about coming up with the idea and then going to the neighborhood or the community and saying, this is what we're going to do. That's doing to. Doing with is they are with you, the community that is the most impacted by whatever condition you're working on, whatever situation you're working on, that they are working with you hand in hand to come up with those solutions. Sometimes it's nice to see things visually rather than having to read them. I think this graphic does does a great job of making that distinction between equality and equity. Equality is giving everybody the same thing, regardless of what their needs are. We know that's insufficient for many of our communities that are the most impacted. Equity is giving them what they need to be able to succeed and be the healthiest that they can be. That's the distinction we want to make sure that you're being able to see and we're able to read through that LOI. A few more reflection points to look at related to equity. One, there's a couple of them I want to call out. The first listed item, identify and understand the intersections between determinants of health, health disparities, and the relationship to health equity. If this is a new space or a new way of thinking for you, there's a slide at the very end that has a resource list that has several hyperlinked resources. Please feel free to explore those resources. If they work for you, feel free to use them. If they don't, feel free to leave them, no big deal. But know that we have created a resource list that may be helpful to kind of poke around and explore a little bit. The third listed item I think is also very, very critically important when we're talking about equity. You have to disaggregate the data to understand who is the most impacted. You have to pull that data apart down to the lowest level you can. So if we're talking about wanting to impact diabetes in South Phoenix, we need to understand who has diabetes, who has pre-diabetes, what's their genders, what's their age ranges, what's their neighborhoods, what is their race, what's their ethnicity, as much of that information as we can, because then we have a better understanding of who we need to be talking with to come up with the solutions. Some reflective questions to think about if your project is working towards health equity. I feel like these are just good discussion questions that as you're working through in your group, you're able to identify, hey, we're really strong in some of these, not quite as strong in some of these others. Here's some opportunities for us to learn and grow. And don't feel like if you identify opportunities to learn and grow that you shouldn't include those. If you have the space to say, hey, you know, in our group discussions, we identified that we really need to learn and grow in this area, that's great, because that means you're learning throughout the process. Community partners. As I said, if it's one organization submitting this LOI by themselves and no partners are listed, it will get pulled. These require partnerships. The primary applicant must be an Arizona-based nonprofit, but you define who your partners are. It may be neighborhood associations, it may be groups of concerned parents, concerned students, it may be large institutional nonprofits. Those partners are your partners. We're not defining what those groups look like for you, okay? Typically, it's not 3 individuals not connected to organizations. I don't know that we've had any circumstances where that has happened. It typically is groups of people, whether it's through organizations, coalitions, or alliances. Make sure to clearly identify who your partners are. At this stage, you don't need a letter of support. You don't need letters of commitment. You just need to identify who those partners are. I didn't say this in either one of the other sessions, but I will say we're good detectives. Don't list people that you haven't talked to. Okay, just a word of caution. All right, so by nature, if we're talking about a policy or practice change, and you've succeeded in that practice change, it is sustainable. Okay, so we're not asking, you know, how are you going to continue to fund the other parts? If you can reflect on that in the LOI, great. But be really clear about what does sustainability look like for this project, and then if we succeed, this is what that might look like. But that's beyond the grant. And so acknowledge that's beyond the grant. Health outcomes is actually a section this year that we have called out as a specific scoring criteria. You would think as a health foundation, this would have been like our norm as like our priority one. We see health in everything. And by seeing health in everything, we did not have it as a specifically called out. Reviewer feedback has been that they would like it specifically called out. So, okay, great, we will. Make sure that the health impact you are working to address is clearly identified. That health outcome may be defined as changing a health disparity. It may be a health behavior. It may be multiple health outcomes that may all be intersecting together. That's fine, but just make sure you're really specific about it. The fourth listed item is another one that, if you can, talk about the mechanism of how you think that health impact will be impacted, that health outcome will be impacted. You may not know what that mechanism is, and that's okay. But if you do have some idea around it, articulate that. So that might be, how you lay out a traditional logic model of, if we do this, then we think this will happen in the short term, this will happen in the medium term, and this will happen in the long term. That's your mechanism. That's your how you think this will unfold. You do not have to turn in a logic model for the LOI though, so before you start to panic, don't. Should be pretty familiar to folks. We talk about social determinants of health quite a bit. We absolutely acknowledge and recognize that health is more than health care. It's not only health care. We know that. So we have to work in the other 80% of what's going on in someone's life to help support them to be the healthiest they can be. Have you ever tried to talk to a city planner about social determinants of health? Have I ever tried it? City of Phoenix, you could successfully do that. City of Tempe, you probably could. Some of the other cities, not so much. We really tried to figure out, a couple of years ago, we started the Year of Healthy Communities, really thinking about how do we help everyone participate in this conversation. So what we did is reframe social determinants of health as elements of a healthy community. You can talk with anyone about, hey, what do you think makes your community healthy? That connects, that makes sense for most people. What we're looking for in these innovation grants are policy or practice changes that happen at the intersection of multiple elements of a healthy community. We're not talking about one, we're looking for those intersections. Almost everything you tackle will address 2, 3, 4, maybe more. But we want you to be able to articulate, what is that intersection? What are those parts that are connecting that intersection? If we're working on a smoking policy change, that smoking policy change will impact health. It may impact employment. It may impact income. It may impact housing, because now you can live in a different place if you're not smoking, or it's healthier for you to live in that place because you're not smoking. So you can see how that one policy change is intersecting with several different pieces. Make sure to articulate those intersections. All right, the fun part, the budget. So the innovation grants are between $75,000 and $125,000 total. That can be spread over 1 to 2 years. I will tell you the couple of projects we have had submit for a 1-year project have all had to request no cost extensions. All of them. That's okay. We're perfectly flexible in doing those no cost extensions, but just know if we're talking about policy and practice change, it rarely is fast. It typically takes that full 2 years. So if you want to apply for 1 year, that's fine, but know that it may take a second year to be able to have that happen. A short list of what funds can be used for: personnel, consultants. We expect this work. It has to be done by people. So we expect you to use the funds for people, whether they're your staff, whether they're consultants, whether they're other teams, evaluators, whatever that might be. It's not federal money, so you're also welcome to use it for food. You're welcome to use it for travel. You're welcome to use it for convenings, whatever those pieces might be for you to advance the work that you're doing. You're also welcome to use directly related to the project for operating expenses, administrative expenses, and indirect expenses. We don't set that rate. We don't have a set rate like the federal government or even state governments that say, you can only submit for up to 12%. It's what you need for your project that is directly connected to the project. So you cannot submit indirect expenses that are not directly related to the project. So just to summarize, The ideal innovations is we're really looking for projects that result in a policy or practice change that improves the health of a specific population. It's specific. Addresses the root causes or barriers to healthy communities related to that policy or practice. If you've ever done some digging in project management, you might have come across the 5 whys or fishbone diagrams. Those are 2 additional resources that are listed on the resource page. Feel free to explore those. It's a great way, you know, the annoying 2 or 3-year-old that you get to hang out with and goes, well, why? They're actually brilliant because that helps you get down to like as close to the root cause as you can. Make sure there's a clear alignment and understanding of those intersections of elements of a healthy community, and then also make sure that that health equity lens approach to the work is clearly defined. Another way to look at this, again, recognizing folks absorb information through visuals and through written, is that we acknowledge there are those structural inequities. What is that piece that you're trying to change? What's the community-driven solution that's absolutely using that health equity lens that those most impacted are informing and contributing to a solution? Addressing those social determinants of health, leading us to healthier, more equitable communities where individuals are able to be healthy and resilient. All right, I'm going to take a quick pause before I go into more of the logistics of next steps. I'll take any questions in the room, and then I'll take any questions that are online. So if you're online, please make sure to go ahead and type those in the chat function, and we'll get to them. All right. Yes?
If we're part of the national nonprofit, are we eligible?
So we have worked with that several times. So the Nature Conservancy has a current grant with us, but it's their Arizona local office that is implementing the work, although the grant award actually did go to the national office. So the question for those online is, if you're working with a national organization, are you still eligible? And you are, as long as all of the work is occurring here and the indirect costs are incurred for the work here, not at the national level. Okay? Yes.
If an agency is a current grant recipient of ILS, but not an innovation grant recipient, can they still apply for this?
So the question is, if an organization is a current grant recipient, but not an innovation grant recipient, are they eligible to apply? Yes, they are eligible to apply. They may be receiving technical assistance, consulting, programmatic grant, medical assistance grant. There are many different kind of other little pools of money that we have grant funding coming through. They are eligible. It's only if they are an active innovation grant recipient that has not closed out their grant. And I'm not crazy for repeating these questions. It's to make sure folks online can hear what the question is. Did I see another hand? And again, there'll be more chances to ask questions. I'm just doing kind of the first straw poll. Okay, so online, I have a question that came in. Could you explain practice change a bit more as opposed to policy? This is a great question. This is one that has come up in all 3 sessions. The way we have described the innovation grant for the last 2 years has been a policy, a regulation, or a culture change. Culture change is kind of hard to, it's kind of squishy, like it's one of those squishy pieces. Great, but squishy. Regulatory, you immediately go to actual like government regulation. What we were trying to do was encompass some of the other practice changes that might happen that are in between a policy and a regulation and culture change. So that's what practice is kind of falling in between. I'll give you an example. One of our current grant recipients, Chandler Fire Health and Medical, they did a lot of research, digging back through their records, talking to their firefighters, talking to their social service partners, and talking to their patients, trying to identify how they could better serve their community. Resoundingly, it came back, you don't do a great job serving behavioral health needs of our community. You don't. They're going to the wrong place, they're escalating situations, they end up getting arrested, not getting the treatment they need. So, okay, we've identified what we could do better. Let's figure out how to do that. So their innovation grant has been working with Arizona State University for evaluation and curriculum development. Crisis Prevention and Recovery, several other behavioral health organizations, Mercy Maricopa, Mesa Fire Department, a couple of the other East Valley Fire Departments. They've developed an additional behavioral health crisis support training for firefighters. They receive less than 8 hours of behavioral health training as a paramedic. And the majority of firefighters are EMTs, so it's even less than that. Yet it's a significant number of calls. So that practice change is now every single Chandler firefighter has been through at least the base 4-hour curriculum. This is now part of their new standard of every new firefighter that comes on board receives this training. The way this is scaling beyond the grant is that this curriculum is going to be available to all of our firefighters throughout the state, as well as available nationally. So they have created this great curriculum that's going to be able to go, okay, great, here's some of the most critical pieces we need to do as firefighters to better serve our community. If you still have a question about practice, let me know from the online group. Hopefully that clarified for folks in here in the room as well. Yes, the PowerPoint presentation will be available. You'll have a PDF of the slide deck, as well as a YouTube link to the full recording. Those will both be posted on the information-meeting. You'll get the hyperlinks, don't worry about it. That's definitely the easiest. Let's see. Another question that came in online is about describe the intersectionality importance. We believe very firmly that you cannot tackle any one of these social determinants of health as an individual item. Any policy or practice change is going to fundamentally affect multiple pieces. Using that Chandler example, the practice change is now having that crisis support training for all firefighters. If you look at the social determinants of health, that's affecting access to care and coverage, social justice, housing, potentially education. That if you're able to de-escalate a situation rather than escalate it and better care for that individual and give them the resources they need, now they don't enter the justice system. Now they're not prevented from going to school. They're not prevented from quality housing. So you can see how that path connects. What we want you to do is to articulate that intersection. All right, let's see. Man, they are throwing in a lot of questions quickly. Let's see what else we have. Can cities be the primary applicant or award recipient? Yes, they absolutely can. City of Chandler was the primary award recipient, as well as the city of Goodyear has been, and the city of Phoenix has been. There's a question about equipment, and could this be used for a startup nonprofit? Equipment is one of those capital expenditures. Now, if you need like an iPad to be able to do remote work, that's fine. But what we're talking about is like, you're going to buy iPads for all 50 employees. That's probably not. But if it's directly related to the project, then we definitely can work through that question. For the purpose of the LOI, you need about a 2-sentence budget description. How much are you asking for? Is it a 1 or 2 year? And in general, what are you planning to use those funds for? We just like to give you more information up front, so as you're starting to think through that budget process, what it might look like. The funds need to be directly related to a policy or practice change. So the other part of that question was, can the funds be used for a startup nonprofit? We don't have any particular restriction around how long a nonprofit needs to be in existence. We've had plenty that are fledgling, which is fine. Like, we're okay with that. Part of what we do is kind of wrap around love and support through the process. So you get a little additional technical assistance. So being a startup nonprofit does not preclude you from participating. We don't have any requirements around how big your budget has to be, how long you've been in operation, any of those things. So another question about project evaluation. Project evaluation is not specifically called out in here. You only have 2 pages. We're not expecting you to have the full evaluation figured out at this point. We know that that's part of the process. You've got to identify your result and then work backwards on how to evaluate it. If you want to put a few sentences in there, you're welcome to. But we really ask for the depth of evaluation and the full proposal, but do know that evaluation can be used in your budget completely There's another question about continuation of an existing program is not allowed. Are there exceptions? No. If this is a continuation of an existing program and you're looking to expand the program or replicate the program, this is not the funding avenue for you. This has to be a policy or practice change. It could be to have that program implemented statewide. It could be to make this as a requirement, whatever that might be, but that's the policy or practice change. The program then becomes a tool. It's not the focus, but I will tell you right now, if the focus is a program, expansion or continuation, it will get pulled pretty quickly. In addition to the project, can any funds be used by a coalition to complete their nonprofit application status? If it is deemed that that is a necessity to move forward through the policy and practice change, then we have worked with some to do that process. I will tell you, for most of them, they have come to a realization that that's not the direction they need to go. The majority have actually said, you know what, we're better off staying as a fluid coalition and working with a fiscal sponsor for this grant application. So know that we can work through it, but we also will help you in kind of thinking about to be or not to be a nonprofit, and sometimes the answer is no, we shouldn't be. In addition, oh, nope, I just answered that one. So this has to be a totally new program. Yes, it's not a program, remember, it's a project. Defined start, defined end, that is a policy or practice change. It is not a program that is ongoing. That has to be really, really clear. And then the funding is $75,000 to $125,000 total. It's not per year, it's total. I know that's not a lot of money, but it can help move the dial or give you a little push to get over the hump. I know it's not a ton. I wish we could do more. I really do. But so far, I haven't been able to needle our board for more money. I'm trying. Don't worry. I'm trying. Maybe next year. Okay, for those online, if any other questions come up, please feel free to send those forward. Otherwise, we're going to go ahead and keep moving. If you're in the room, please feel free to continue jotting down questions. All right, next steps. Number one, meetings are not required. You do not have to meet with one of our staff one-on-one. You don't have to. But we are an open door organization up until the moment you submit that LOI. We are here to help you in that process, brainstorm with you, help you be as successful as you can. But it's not a requirement. What I will ask that you do is if you're already actively working with one of our staff members, please continue working with that staff member. You don't have to work with me. If you want to work with me, that's great, that's wonderful, I will help you. But if you're already working with somebody else, feel free to continue working with them. If you need to schedule a one-on-one conversation, at this time frame, they are 30 minutes. We are talking about your specific idea and pulling it apart to make it as strong as we can. This is not the brainstorming session. Those happened between April and yesterday. At this point, we need to be getting into the weeds to get as detailed as we can and help you. When you submit that request, please email it. You can email it to myself, you can email it to Jennifer, you can email it to the staff member you're working with. Include 2 to 3 dates and times that you know already works for you. That'll help eliminate some of the email ping pong that typically happens around meeting scheduling. It just helps the process flow a little faster. This outline is your draft of your LOI. This is directly on our website. So you will see the whole thing listed out there on the website. It goes through each listed section about what we're expecting. There's not a specific layout that you have to use. You are limited to the number of pages, and I'll talk about that in just a second. You can put them in this order. You can regroup them in a different way. Just make sure that all of these are addressed. You'll see in blue, elements of a healthy community is underlined. Just got a notification for folks that they can't post online anymore. Huh, interesting. I don't know. hopefully, okay, looks like it's come back on. So the elements of a healthy community, we have a 4-page handout that gives more description about the elements of a healthy community. It will be hyperlinked here as well as uploaded, so you can download that, take a perusal at those different details. A few tips, be specific. You can't go for the moon with $125,000. Like, it just doesn't work. And I will tell you right now, if the reviewers feel it's unrealistic, like just totally out of the ballpark unrealistic, that doesn't move you forward. That makes them go, what are you thinking? So be specific, be realistic about what you're working to accomplish. Use the feedback from the staff conversations if you have one. Those conversations are shared with the reviewers. They will know some of those recommendations. Only one letter of intent per organization. You do not need a separate letter of intent for all the partners. You need one letter of intent for the group doing the work. The LOIs are due September 28th by 5 p.m. Arizona time. The web portal, we've shifted over to an actual grants web portal this year. I'm sorry, this is the first year. You guys are our guinea pigs. We will work very diligently with you in this process, but the portal will close at 5:01. So please, please work with us and communicate with us ahead of 4:45 on the 28th if you're having any issues with it. And if you submit your LOI like 3 days before and you go, oh man, I just learned about this great partner to work with, send me an email. I can reopen your LOI and send it back. No problem. And then you can update it and resubmit it. Notifications for full proposal invitation will be out by December 3rd. I know the one pager says November 28th. I will try to adhere to that November 28th deadline, but darn Thanksgiving gets in the way at the end of November every time. So I was trying to be a little forgiving to myself at Thanksgiving. So your submission guidelines, again, these guidelines are laid out online. Your LOI cannot be longer than 2 pages. You may single space that LOI. Please use tall point font for the reviewer's sake. And we've listed a handful of font types that are just a little easier to read that would be preferable. Accepted file types that can be uploaded, PDF, DocX, text, JPEG, PNG. Got a lot of options. Just please don't upload a doc file, a DOC, because of virus scanning. We need it to be a DocX. Here's your timeline. Again, it's on your one-page flyer as well as on the website. So you have several different spots. You can take a look at that. And like I said, this is not just a grant. Here you go have fun for 2 years and come back. We really want to be your partners. We reframed that conversation to be funded partners rather than grantees. And it's because we want to be working alongside you and investing in you as people, in your organizations, and in your collaboratives, all the way across the spectrum of the work that you're doing. We have quarterly learning sessions that are here in the office. We have them with lunch. You can attend by video conference. You can attend by phone. The other great part is that this last year we were able to move forward with, we do cover your travel if you're traveling from outside of Central Phoenix, as well as we do cover some of your time to be here. You do not need to factor those into your grant budget. So those are accounted for. Our reporting requirements is we do semi-annual reports, you know, the typical stuff. Are you accomplishing what you said you did? What's your budget look like? Do you need to make any modifications? But really what we're excited about are what are you learning? What lessons are you learning? What things can we share with others to be able to help move their policy and practice pieces along? All right, so I'm going to take another pause. We've got probably 2 to 3 minutes for a few more questions if anything's come up around some of the logistics, either online or in the room. Go ahead.
While lobbying activities are not permissible, is a government consultant allowed?
We have had policy consultants be funded. So they cannot use that time to directly lobby through the grant funding, but they absolutely can hire a policy consultant. We have a current project right now with Sonoran Prevention Works where they are working with Creosote Partners, which is a lobbying firm for their policy advice and their policy consulting. So they are actually using other funds for their direct lobbying, but do remember, as a nonprofit, you can advocate till you are blue in the face all the time in the world you want to take. The other thing is you can lobby. You have a certain percentage, as long as it's I don't remember the specific language, but it equates to approximately 20% of your budget. You can directly ask for support for a bill. Now, you cannot lobby for a candidate. That is not allowable. Do your research, work with your CPAs, work with your finance folks. You have to very carefully track that time. But if you are working on a policy change and it's a legislative law policy change, you can work with a policy consultant, but know that the funding from Vitalist cannot be used for the direct lobbying time. But a lot of times that's actually a very small amount of time that's actually lobbying rather than advocating. So just be really clear about that. Let's see what else we have on here. So another question about clarify that this must be a new program with no funding and not an existing program with an expanded program focus. Hey, I'm going to be really clear again. This needs to be a project, not a program. I will tell you right now, if reviewers see the terminology program, it's going to be a fluff. It doesn't mean that it's pulled, but it's going to set up. This is ongoing, because that's typically the way a program is described, is ongoing. This needs to be a policy or practice change. Start and a stop. Another question that came in is, would a 170C1 be considered for this project? I do not know that IRS regulation. I will have to talk with our finance to find out related to that. I will say that it has to be an organization who is eligible by IRS regulations to receive charitable contributions. That can be government, it can be faith-based, it can be a nonprofit, it can be a nonprofit fiscal sponsor. It cannot be a 501c4, which is a direct lobbying agency. That is not eligible. I know that for sure. So I will have to check on the 170C1. I have no idea what that is, but we'll find out. Any other quick questions, Mary? Yeah.
The budget breakdown for the partners, do you care how that is broken down?
Whatever your project needs. That is not for us to decide. That's for your team to decide. Okay. And don't feel like if you don't get your question out today that it's over. You can email me anytime and I'll address those questions. All right, so for better or for worse, we are moving on to an online grant management platform. I think it will be better. I am confident it will be better because we actually will have everything in one spot, which has not been the way we've been operating. We've had Bluetooth and Excel forms, so it's going to be adventurous. So I'm going to give you a quick peek at what this looks like. So everyone should have a one-page handout related to how to submit your LOI, not to set the standards, but my 9-year-old has followed these instructions. I just want to make sure you know we have also internally tested it with a bunch of different ones of us, some that are connected to this and some that have never seen it before. But if you do run across some questions, please don't hesitate. For some of these, I think I got the phone number down at the bottom. If you don't have the phone number down at the bottom, you can reach me through my office line, you can reach our main line, and we'll be able to walk you through the process. So I will send this to you as a PDF, so you don't have to retype the link. You can just click on it. What you'll want to do is to set up an account. So you'll go to sign up, type in your email and your password. I would recommend that you use like an admin or an info email account or someone that can be kind of your primary point of contact, because this will be the email address that's tied to this letter of intent all the way through the innovation grant process. Okay, you can have multiple email accounts associated with one organization because you might have a programmatic grant, you might have a medical assistance grant, but those aren't the people working on the innovation grant. We understand that. But I will say that this email is who will be working through the innovation grant process. So please be thoughtful about who you set that up under. I'm gonna go back a page and log in under mine so you can see what it looks like a little bit once you get in. And like I said, if you make a mistake, you submit it by accident, almost all of this you can edit at any point. And if you submit it by accident, just send me an email and I'll kick it back to you. Not a problem. So you can see you have a profile. You'll have a create button because it's not been created yet. Make sure you put in your name, phone number. You don't need to re-put in email. It's already tied by setting up your email account. The organizations are in a drop-down list. We have pre-pulled in every organization who submitted an LOI over the last 3 years. We know that there's probably going to be new ones this year. That's fine. Scroll all the way down to the bottom, and you'll see a 0 organization is not here. Click that, and then you can fill in your information. Okay, so that's your applicant profile. Once you set up your applicant profile, you'll then be able to create your LOI. You can see mine's under review, which means I have a test one submitted right now. So you'll be able to create your LOI. What you'll do is log in here. I can still show you what it looks like a little bit. So it's going to ask, are you the primary contact for the LOI? If you say no, it will give you fields to put additional information in. Again, for simplicity, I would recommend that it be. The person you set it up with should be your yes, but we know that sometimes that's not always the case. Is this applicant organization eligible to receive charitable donations? Yes. If you say no, say you're a coalition, you're an alliance, you're a group of organizations, or a group of, a neighborhood group, and you say no, it's going to then ask you about your fiscal sponsor. That's perfectly fine. Again, we have no problem working with fiscal sponsors, but we do want to know who you're working with. And then it'll ask you to upload your 2-page LOI. Again, PDF, a docx, a text file, a PNG, or a JPEG file. Those are the 5 types that would be accepted in that portal. So the big thing, and it's also on your sheet, is to make sure on this screen you'll have a blue save button that you click save. That will then take you back to the account homepage where you will click submit. If you don't click submit, we don't get it. I mean, we'll see it's in draft form, but we can't pull it in from your portal with it just being saved. Okay, so it's really important that you submit that. All right. So we do have that kind of broken down on the slide deck so you can see it in steps. You have the handout. I will also send this as a separate PDF so you'll have it accessible. So what I do want to show you is you have my contact information, Jen's contact information here, and then also the last one is, go 1 page, there we go. The resources to explore. So these are several of those different resources I talked about during the course of today. Again, take them or leave them. They're resources that if they make sense for you and for your group, great, use it. If they don't, find a different resource that makes sense for you. Okay, so any other questions that have come up? I figured there'd be some more. Go ahead.
So in addition to the 2-page LOI, do you want a budget?
Nope, 2 sentences.
2 sentences about the budget.
How much are you asking for? Over how long? In general, what are you planning to use those funds for? That's it.
So no list of the other partners should
Please list your partners
in the LOI.
in the LOI. You do not have to break down your budget allocation for those partners. But please list your partners. So we want to know, what are you going to do? Who are you going to do it with? And how are you going to do it? So that's the 3 big questions that, all the other detailed things should be addressing. So just kind of keep those in the back of your head that guys reread it, did I answer those 3 big questions? Please do give us a couple of sentences about the budget, but it literally can be, this project is requesting $125,000 over 2 years. We're anticipating the majority of the budget to be used for personnel and consultants as well as convening and travel. Done.
You tied the fiscal sponsor and you did a question regarding 501c3 eligibility together.
Mhm.
If we are eligible, but we are using a fiscal sponsor, and we put yes for the 501c3, there's still a way to include fiscal sponsor.
So that's a good question. How we got factored in that logic. So, of course, you would ask me that question. Now, in the full proposal, yes, we do have that factored in. At the LOI stage, we do not. What I would ask is that you just reflect that in your LOI submission. So it's okay if you say you're eligible on the quick form, but then in the LOI, indicate that you're using a fiscal sponsor. That's fine, and just indicate who that fiscal sponsor is, because we do have a lot of times at collaboratives, like all 4 organizations are eligible to receive charitable funds, but they choose to go with a fiscal sponsor to reduce the power dynamic. Completely fine. That's how we're handling it.
Yeah, you referred to programmatic money. It's determined that we're more of a program, less of a project. Is it possible to apply for a program?
Our programmatic grants are not an open RFP process, and sometimes we'll have projects that are directly connected to our active work that we identify through the innovation grant process, but it's not a formal piece. So what I'd encourage you to do is explore our website around those different goals and see the different pieces of work that we're working on. So for myself, some of the programmatic pieces that I work on, we definitely embrace the full time, talent, and treasure. Treasure is just the financial investment. We firmly believe that our time and talent is also a contribution to whatever piece of work we're working on. So for myself, I do a lot of work with fire departments and mobile integrated healthcare, as well as our Diabetes Coalition and Community Health Worker Coalition. So those are 3 areas that I actually have some additional programmatic investments that occur related to coalition building, alliance building, technical assistance, those types of things. And then all of our other directors also have pieces that are related to that. I would say, if you see a piece that's really connected to one of those goals, then it might be worth a longer conversation with staff. I would just ask that you not make that request until after the LOIs are done. We do typically have about 80 to 85 LOIs that come through. Those then go down to between 8 to 12 proposals, and then 3 to 5 end up funded. The other great part with that, though, is that we are, everybody jump in the same pool funders, so we shop these proposals around to other funders. So we want to try to bring everybody into the fold. If somebody else is a better fit, they want to take it, it's yours, fund it. But you are still included in our learning sessions regardless of who funded the project. So just know that even though you're funded by somebody else, you're not kicked out, you're still included. Any other quick questions that have come up? Guessing nothing? Nope. Okay. There was one other quick question that came in online. I'll address it and then we'll close it out. And it just asks if the project must have a beginning and end. Does the policy have to be completed by the end of the grant? We know that these are not always successful. You're not always going to have a big win and say, yes, this policy passed. But you do need to have clarity around what your proposed piece is with the innovation grant, knowing that it may take a little longer and acknowledging that that may happen. So that's fine. All right. So if any other questions come up, please don't hesitate to send us an email or give us a call on the main line. We'd be happy to address those. Thank you, everyone, for coming today.